if you click this video away, then please tell me what the reason was so that I can improve. Otherwise, hi and welcome. I am trying to learn medicine. Today, atrial fibrillation, and after we've done that, we're going to do stretching. And if you participate in the stretching, then it's at your own risk. And we're talking here about the blood system, internal anatomy, and problems with the heart. And this is no medical advice. We're just reading about it and trying to understand it. And this is now the second part. And now we're trying to gather the information about atrial fibrillation together, and then memorize them, and then try to do a presentation about them. Atrial fibrillation, an irregular beating of the heart. The atrium in the chamber of the heart, from which the rhythmical contraction spreads to the rest of the heart. Okay, the atrium, from which the contraction of the whole heart starts, is irregular, the rhythm of the beating of it. In atrial fibrillation, the contractions lose their rhythm and the heart beats regularly. Okay, the beating, which is normally in a good rhythm, spreading from the atrium on over the whole heart, is then not properly in a proper rhythm, or irregular. Atrial fibrillation may occur in sudden, intermittent attacks, but more usually it persists once it has developed. Older people are most affected. Okay, it persists as soon as after it had developed. Okay, symptoms: palpitations, shortness of breath, vague feeling of tiredness or being unwell. Sometimes there are no symptoms. I still don't know what palpitations are, but now I want to take one look if it's maybe in this book. Palpitations. Awareness of the heart beating. This is normal with fear and after having exercise, but it may sometimes be a symptom of heart disease. Palpitation is the feeling of a heart beating. Is to feel the heartbeat when someone does sport or something, or is afraid. Meta palpitations. The awareness of the heartbeat. Okay. Atrial fibrillation. It can be palpitation. So, feeling the own heartbeat. So, by palpitation, feeling the heart pumping. Shortness of breath, vague feeling of tiredness or being unwell, and more symptoms sometimes. Duration. Intermittent attacks may last minutes or hours, and they may recur over many years before becoming established. So first minutes or hours, and then we're getting more often until they are persistent. Persistent atrial fibrillation lasts forever without treatment. It persists once it has developed, so it starts with minutes and then hours, and then it gets more and more until it is persistent all the time, if there's no treatment happening. Causes. Very often no underlying cause can be found, or congenital deformity of the heart, or thyrotoxicosis. Let's take one look. THY. Thyrotoxicosis. Overactivity of the thyroid gland due to overstimulation by the pituitary gland at the base of the brain. It causes toxic reactions in the body. The condition is also known as Graves' disease. Treatment, none advised. What the doctor may do. Anti-thyroid drugs to control the secretion of the thyroid hormone. So it was the thyroid gland is overly active, and that causes the pituitary gland to be overstimulated. That causes a toxic reaction in the body. We're just gonna leave it. That's too complex right now to explain. Again, this is no medical advice. I just read it and try to understand it. Okay, the causes are no one found. The book is from the 70s. Maybe there's more on. So oftentimes there's no cause found. It can be congenital, but there's a deformity at the heart, or Fibrillation. Fibrillation, we're just going to say that. It's something with an imbalance of the thyroid is overstimulating the pituitary glands, so they are not doing bad on it. Complications. Heart failure with congesting of lungs and swelling of ankles. This will cause shortness of breath, palpitations, and an irregular pulse. Now, I don't know what congestion is. I said it in the first part, but we're having a good run, so how about we looking another thing up? Congestions. Now it's okay, not here. Congestion of lungs and swelling of ankles. We're just going to say it. Congestion of lungs and swelling of the ankles. Shortness of breath, palpitations, irregular pulse. We had also vague feeling of tiredness and unwellness. And a pulmonary embolism is a frequent condition. Treatment in the home. Sit down and rest. Consult the doctor as soon as possible if an irregularity of the heart rhythm is suspected. What the doctor may do. If the heart is still beating irregularly at the time of examination, the doctor will usually be able to diagnose atrial fibrillation, which he or she will often confirm by an ECG, a tracing of the heart rhythm. If the attack has stopped, he or she will be unable to say for certain what caused it and will look for an underlying cause. He or she may prescribe treatment to help the heart beat more slowly and efficiently, or send you to hospital for electric shock treatment to the heart to stop the irregularity. As there is a danger of blood clots developing in the heart, anticoagulant drugs may be prescribed. In this case, it will then be necessary for the patient to have regular blood checks. Prevention. Little is known about preventing atrial fibrillation. Outlook. With medical treatment, atrial fibrillation can continue indefinitely without ill effect. So, complications. They have written two things for complications. Congestion of lungs and swelling of the ankles, that causes then shortness of breath, palpitations and irregular pulse, and then pulmonary embolism. And they're giving here, they're saying anticoagulant drugs. That is the only thing you said now as the permanent treatment. So it seems that these anticoagulant drugs are the treatment so that the person can have atrial fibrillation without getting ill effects, or serious ill effects. One look to pulmonary embolism. I think I know what it is. Did we do embolism? Blockage of blood vessel in the lung, usually caused by clot of blood. So one of the, occasionally the cause is fat after a bone fracture or air after a diving accident or an error in injecting into a vein. Whatever the cause of blockage is called an embolus. A clot of blood develops in a segment of inflamed vein, thrombophlebitis, elsewhere in the body, becomes detached and is then carried up the veins through the heart and into the lungs. Thrombophlebitis most commonly occurs in the veins of the leg when the patient has been immobilized after injury, operations or childbirth. The pelvic veins are another common site of thrombophlebitis after abdominal operations. Some people and families are especially prone to attacks. So blockage of a blood vessel in the lungs. Okay, we have all the information. It is atrial fibrillation, the atrium from which the rhythm from which the heartbeat is started to the heart, from which the rhythmical contraction spreads to the rest of the heart, is irregular. And it are palpitations, shortness of palpitations, so feeling the heartbeat, shortness of breath and feeling of tiredness and unwellness. And it develops with slowly minutes and hours and then permanently. now cause found can be congenital or thyrotoxicosis. We could just say it, a problem with the thyroid glands, and I think that may be helpful. The problem with the thyroid and the pituitary glands. Overactivity of a thyroid gland due to overstimulation. No. The pituitary gland is overstimulating the thyroid gland. What is it? Overactivity of the thyroid gland due to overstimulation by the pituitary gland at the base of the brain. Okay, the pituitary gland is overstimulating the thyroid gland, leading to toxic reactions in the body. It's the thyroid, and that's exactly sure that is the thyroid gland, and is doing the overactivity because of the overstimulation from the pituitary gland. Thyrotoxicosis. We don't have time. Thyrotoxicosis. I don't think we have time left. Maybe we can do it in the first try of the presentation. But I don't think thyrotoxicosis. Let's spend one more time on one more video. But having it all together, we're having let's do it shortly. The atrium, from which normally from the atrium out the rhythmic contractions spread over the heart and letting the heart contract, and now by atrial fibrillation, the rhythm is irregular. Symptoms of palpitation, feeling the heartbeat, and shortness of breath, and feeling of wakeness, and a vague feeling of tiredness, and of unwellness. And cause oftentimes unknown. It can be a congenital deformity at the heart, and it can be thyrotoxicosis. And that is that the thyroid gland are overstimulating the pituitary gland. It must be the other way around. So we're going to do it in the next video probably. It was one over the other way around. The pituitary glands are overstimulating the thyroid gland, and we're having now overactivity leading to ungood toxic reactions in the body. We're going to read it again. Thyrotoxicosis. And then, if it's not treated, it can lead to congestion of the lungs, and swelling of the ankles, palpitations, shortness of breath, and irregular pulse, and also to pulmonary embolism. So blood clot in the pulmonary veins. And there are anticoagulant drugs, and with them, the treatment, it should be possible to live with it without dying from it. Now, that was the medical part. We don't have time for the presentation now. We're going to do a presentation in the next part. That means we're going to do a third part to atrial fibrillation, and there we're going to try to make a presentation based on these information we just had here. If you were here for medicine, you can go directly to the next part. If you stay here and participate in the stretching, then it's what it is. We're having the legs standing together, and we're opening with one foot to the side and with the other one. With the heels and with the heels. A rooting tree exercise. Always with heels, toes, toes. As far as you can go. And then again in. But now stay down. So go into the knees, stay down with the head. And up again. Legs a bit wider apart, the breathing in and lifting the arms up. Without and out to the side. In and to the middle. Out and to the other side. In and to the middle. Out the arms down. Now breathe in. And out, and one hand slides down the leg, and the other shoulder stays down. Breathe again in. And out, take one arm over. Breathe in and out, the cage. And out, back into the middle. Breathe again in. And out, one hand slides down the leg, and the other shoulder stays down. Breathe again in. And out, one arm over. Breathe in and out, rib cage. And out, back into the middle. So, let's just do the trunk, ignite up, breathe in and go down. And breathe in and out. Again in. Out and down. One more round, breathe in. And out. Again in. Out. Again in. Out, bring the hands together and the hands down. It was a short stretching. I thank you very much and until next time.